Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Shoulder replacement, preventing post-op complications. Introduction. Over the last few years, shoulder injuries have become more common because people are exercising more frequently. To relieve your pain and restore mobility, your surgeon has performed a shoulder replacement surgery. This program will help you understand better the possible complications of this surgery. Anatomy. The shoulder joint joins the upper body to the arm. The bones involved in this joint are the following: the scapula or shoulder blade bone, and the humerus, the upper arm bone. These bones are covered by special tissue called cartilage. The smooth surface of the cartilage allows for smooth, painless movement at the shoulder joint. Ligaments connect the bones and help stabilize the shoulder. To allow your shoulder to move in all directions, strong muscles attached to the shoulder blade anchor themselves in the head of the humerus through specialized tendons. The combination of these tendons is known as the rotator cuff. The rotator cuff runs under part of the shoulder blade. Surgical treatment. The joint is approached through a large incision in the shoulder region. The upper joint of the humerus, or upper arm bone, is then cut and removed. The removed part is replaced by an artificial surface known as a prosthesis. Depending on the type, the prosthesis may need to be cemented to the bone. At the end of the operation, the incision is closed and the patient usually goes home in a few days. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Possible complications. This operation is safe, but there are several potential complications. These are rare but possible. You need to know about these complications just in case they happen. By being informed, you may be able to help your doctor detect complications early. The complications include those related to anesthesia and those related to this surgery or any type of surgery. Complications of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious complications of general anesthesia include heart attacks, strokes, and pneumonia. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your doctors know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of this complication. Some of the complications are seen in any type of surgery. These include: 1. Infection, deep or at the skin level. 2. Bleeding, either during or after the operation. 3. Skin scars that may be painful or ugly. Other complications are related specifically to this surgery. These again are very rare, however it is important to know about them. Organs around the shoulder area and close to the surgery may be injured, but these injuries rarely occur. Arteries and veins going to the arm may be injured. Nerves going to the arm may also be injured, causing arm weakness or decreased sensation. The pain may not be relieved by the operation. It may even be worse than before the surgery. However, this occurs rarely. The prosthesis may become loose from the adjoining bone or dislocate. A difference in arm length may occur in rare cases. The shoulder may not work as well as a normal shoulder joint. It may feel stiff. In extremely rare cases, the patient may have a potentially fatal allergic reaction to the cement used. After the surgery. Most patients go home a few days after the operation. You may also be given a sling to use for a short period after the operation. You will need physical and occupational therapy to rehabilitate your shoulder.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Sometimes the shoulder can be severely damaged from a variety of causes, such as arthritis or an injury. This can cause pain and limited movement of the arm. When appropriate, a shoulder replacement can replace the joint at the upper part of the humerus, the upper arm bone. The artificial replacement part is called a prosthesis. Shoulder replacement surgery is successful in helping to decrease your pain and to improve your quality of life. This operation is very safe with good results. However, as you have learned, complications may happen. Knowing about them will help you detect them early if they happen. Thank you for using Explain.